Hello everyone, my name is Arushi Gupta. I am a fourth year medical student and today we are going to discuss the brain defects. The three main brain defects which we are going to talk about today include Chiari-1 malformation, Chiari-2 malformation and Dandy-Walker syndrome. So let's begin with Chiari-1 malformation. So as you can see, Chiari-1 is associated with one single defect and the defect lies in the tonsils. So what is happening that the tonsils, they are dipping down. When the tonsils are dipping down, what's going to happen? So for example, a person or a child, because it's seen in young age, they bend down to tie their laces. So what is associated with it? When they bend down, they start feeling dizzy, and that's because the tonsils which were already dipping, now when you bend down or perform something like a Valsalva maneuver, increases the pressure and that causes the dizziness. Now Chiari-1 malformation is associated with something called syringomyelia. What do you mean by syringomyelia? Syringomyelia is a condition of your C8 spinal canal where you see that there is loss of pain and temperature sensations in a cape-like distribution in the upper arms. Now let's talk about Chiari-2 malformation. Chiari-2 is associated with two problems. So you have dipping of the tonsils as well as the vermis. So it's a double problem. But this is usually seen a little later, and this is associated with something called myelomeningocele, which means that you have herniation of the myelomeninges. That means of the matter, the brain matter, as well as the meninges. Last but not the least is Dandy-Walker syndrome. How I remember Dandy-Walker is D is the fourth letter of the alphabet, so there is enlargement of the fourth ventricle, and then Walker, the sound of V is associated with agenesis of the vermis. So it's associated with two problems. You have agenesis of the vermis and you have enlargement of the fourth ventricle, both of which cause something called a hydrocephalus. So you have buildup of fluid which causes increased pressure and headaches. I hope you were able to differentiate between Chiari-1, Chiari-2 versus Dandy-Walker syndrome. They're associated with similar structures but in different ways. Chiari is associated with dipping down of structures, while Dandy-Walker is associated with agenesis of the vermis and enlargement of the fourth ventricle. And then Chiari-1 is associated with syringomyelia, while Chiari-2 is associated with myelomeningocele, and Dandy-Walker is associated with a hydrocephalus. Thank you.
Observerships, doodles, CVs, interviews, we help you match stronger. Contact me at connect@drsinghmd.com.